Hello everyone, my name is Dr. Elara and welcome to yet another episode of my videos. So in today's video, we'll be talking about malaria. I chose this particular topic because, well, I've been seeing patients now for quite a while, and patients come into the hospital and you tell them one or two things about malaria and they totally disagree with you. So I realized that there's a lot of misinformation out there about malaria. Even though malaria is one of the most popular diseases in Nigeria, a lot of patients, and sorry to say, some doctors still don't know enough about the disease, and I would like to debunk some things and put some things out there for everybody to understand, especially when it comes to the diagnosis of malaria. Okay, so I hope you enjoyed the video. I'll see you guys in the next part. Please stay with me. Now, I'm not going to beat around the bush because I know people know a lot about malaria already. But still, let me just put this out there. Malaria is caused when you get infected by the malaria parasite. The malaria parasite is transmitted by a mosquito called the female Anopheles mosquito. So the mosquito bites you. It's trying to feed on your blood. However, it releases some forms of the malaria parasite into your blood that infects your red blood cells, and then you get the constellations of symptoms that characterize malaria. Malaria itself is caused by a parasite. The parasite is called Plasmodium. There are 4 different Plasmodium species. I don't want to go into all of the detail, but we'll be reading in detail later on, so I'm just going to put it out there. We have the Plasmodium falciparum, which is the most common cause of malaria in our environment. Then we have the Vivax, we have the Ovale, and then we have the Malaria. You don't have to bother yourself about it, but just know that the falciparum is the most common one in our environment. I'm not going to bore you people. In this lecture or this video or whatever you like to call it, we'll be talking about malaria under 3 headings: the symptoms of malaria, testing for malaria, which is what is really bothering me, or what I really am interested in talking about. And then we're talking about the treatment for malaria, which may not really interest you as much, but then I'll put it out there. Symptoms of malaria. So when somebody gets malaria, what are the symptoms that the patient presents with? Well, it varies because there are 2 different types of malaria. There's what we call the uncomplicated, or what I like to call the simple everyday malaria. The malaria that every other patient that walks into the hospital will come and complain about. Typically, the cardinal symptoms of this type of malaria are fever. Typically, they have evening fevers, then chills, where you just shake like this, and shake like this. I don't know how to explain it. And then some patients shake a lot, and that's called rigors. And then they feel cold from within. Fever. Typically, all these things are in the evening. Then they can have headaches. The headaches are typically frontal or at the back of the eyes, orbital, as we like to call it. It's in a lot of big terms. Okay. So then there may be joint pain. Then the urine may become darker. Altered taste in the mouth. Those are the things that will just tell you that okay, this patient most likely has malaria. Then that's the simple everyday malaria. Then we have the complicated or severe malaria. This is the malaria you don't want to see. This is the malaria nobody prays for. Typically, it affects 2 demographics of people: children that are less than 5 years old. It is probably one of the biggest killers of children that are less than 5 years old in Nigeria. And then we have pregnant women. That is why it's very important for pregnant women to go for antenatal care, because when you go for antenatal care, we tend to give you certain medications that prevent you from having severe malaria. Okay, so what does severe malaria do to children less than 5 years old? Typically, most times it can cause them to have what we call cerebral malaria. God, I know it's too big. What cerebral malaria simply means is that you have a malaria parasite infecting the brain, and then the child can become unconscious, can start to have seizures, and what have you. It takes God's to get these children out if they don't get treatment on time. It can also cause them to have severe anemia, which means that the malaria parasite starts to eat at their blood cells, and then red blood cells fall, and then that can also kill them because they don't have enough red blood cells in their body anymore. Now, for pregnant women, it can affect the baby, causing the baby to die in fetal death. It can induce labor when the baby is not big or is not old enough to be delivered, and then you deliver a premature baby. it can actually cause the mother to have severe problems too. So that is why nobody wants to see severe malaria. Okay, so if you have a pregnant woman, please make sure you go for an antenatal so you can get the drugs to prevent severe malaria. And then if you do get malaria, you can quickly report to the hospital where they have your history, and then treatment can commence on time. So that's severe malaria, and that's the difference between severe malaria and simple malaria, or everyday malaria as I like to call it. So next we're moving into the testing of malaria. And now you see, this is the part where I usually take it personal, because it is very hard convincing patients sometimes. Okay, so when it comes to malaria testing, there is microscopy, and then there are rapid diagnostic test kits. Microscopy simply means that you take a patient's blood, you look at it under the microscope, you look at it under the microscope, and then you see the plasmodium parasite that causes malaria. This is the best way of diagnosing malaria. If you see the malaria parasite, dead patient most likely has malaria. Okay. However, the problem with microscopy is that, one, if you walk into an average Nigerian hospital, microscopes are not available. Two, even though they are, the proficiency of people that test these things is probably not there. Most of these private hospitals have technicians and stuff that cannot differentiate between the types of malaria parasites. So microscopy is just a big hassle in our environment. Then rapid diagnostic test kits, they are the more readily available one. What these things do is that they test for presence of starting proteins that are produced by malaria parasite. Okay, so and then the color change, when you add the reagents to those proteins, the color change that occurs will tell you, okay, there's malaria parasite in this person's blood. However, it is not very reliable, because sometimes the malaria that has infected the person has not produced enough proteins to give you a positive result. So you test the person and the result says negative, whereas the patient actually has symptoms that are suggestive of malaria. And you as a doctor want to start treating the patient, and the patient will say, no, you did the test, you said I'm negative, so I don't have malaria. And the patient comes back to you in 3 days, it's shaking and everything, and then you help the patient and the patient is fine. So that starts. It can give you what we call false negative results. It tells you that the result is negative, whereas that's false, because the patient actually has malaria. It's just that it has not produced enough proteins for the test to be able to say that, oh, it's positive. Another thing is that it cannot differentiate between the different types of malaria parasite. Another one is that it can't tell you the load of parasite that the patient is infected with. Only microscopy can do that. So it's not the most reliable way. So as doctors, when it comes to treating malaria, you have to consider different things. Where am I practicing? If I'm practicing in Nigeria and the patient comes with symptoms that I think are classic for malaria, I'm most likely to treat for malaria regardless of what the ROT says. Okay. And then if the patient does the test and is saying that it's positive, I may decide if the patient does not have any symptom that suggests malaria, the patient is healthy, the patient just comes to the hospital and insists on doing the malaria test, and the malaria test comes back as positive, the patient does not have any symptoms, I may decide to withhold treating. The reason being that, I'll explain it to you guys, we don't treat based on lab results only. We treat based on a number of things, lab results being one of them, our patients present being another thing. And then we're in a malaria endemic country. Most people have these proteins that the RT is testing for in their blood. They may never be manifesting symptoms, they have it in their blood because they have been infected multiple times. Okay? And sometimes the body has found a way of mounting a response that you don't even need medications to treat or whatever. And then when you go test, the test tells you it's positive and then the patient is system. It's just drug abuse, because if you abuse these drugs, what's going to happen is that you can develop resistance to them and they won't work anymore. Okay? But well, private hospitals don't care about that. They'll treat you anyways. So that is that about that. Now we're moving on to treatment for malaria. Treatment for malaria, again, based on the type of malaria you have. If it's simple malaria, we use simple artemisinin-based combination therapy, ACT. Artemisinin-based combination therapy, ACT, to treat patients. That's your normal donors, Coatem, Amala. There are different ones in the market. Pick whichever matches your shoe color. Then sometimes you treat patients with ACT and they don't get better. It's because most times the malaria parasite is probably resistant or something. Then you have to move on to injectables like artemether, where the patient is given artemether IM for about 3 days or 5 days, depending on how long it takes for the symptoms to go. You give patients this medication sometimes and they don't get better. What it means is that they have a type of malaria parasite in their blood that is hiding inside their liver. And now to clear the liver forms, you need a drug called primaquine. Don't disturb yourself. Primaquine, I think they use it for about 14 days or so. That is how simple malaria is managed most times. Most times, if you take the ACT, you get better. If you don't get better, by the time you take the artemether for about 3 to 5 days, you get better. And then, if you take those 2 things and you're not getting better, you most likely require primaquine to clear the liver forms. That's all about that. Then, complicated malaria. Complicated malaria is a severe malaria, like I said, that typically affects women are less than 5 and pregnant women. This kind of malaria is a kind of malaria that will naturally, under normal circumstances, require ICU admission. But in Nigeria, Booth only has 3 ICU bed spaces. I think it has dropped to 2 now. So I don't know how many lawsuits are. Probably 10 in total in the entirety of government-owned hospitals in Lagos State. So forget about that. It's most likely not going to happen except you have a lot of money. What we typically give patients that have severe malaria, the drug of choice is quinine. Okay, that's quinine. Oftentimes when you give children that have severe malaria quinine, they jump out of their coma by the 2nd or 3rd day. And then if they have severe anemia, you may have to transfuse them and a lot of other medical channels. But the aim is that, if at all possible, we want to prevent people from having severe malaria. That was how I say children should sleep on insecticide-treated nets. Everybody should sleep on insecticide-treated net. Pregnant women should sleep on insecticide-treated net. They should go for the antenatal to get fancy that to prevent them from having the severe forms of malaria. And if you sense that you have symptoms of malaria, like the ones I've said earlier, present early to the hospital to prevent you from having severe malaria. So that is basically all I have for you guys today. I hope you enjoyed the video. In my next video, I'll most likely be talking about typhoid, and most likely be talking about typhoid and how to differentiate typhoid from malaria. And again, the whole diagnosis that most people believe in, malaria typhoid, there's nothing like malaria typhoid that I have put them together. I'll try to demystify this for you guys to understand. Now, my last video was about demystifying some of the myths about coronavirus. Okay, if you want to watch that video, just click here. You see, you can watch that video there. So I'll see you guys next week Friday, where I'll be dropping another video. I hope you enjoy your weekend. Have a nice one.